Dan Williams, Survive Outdoors. Today, medical update. So a couple years ago, I did a video on, actually a year and a half ago, I did a video on aspirin and how do you take it, how much should you take if you're having chest pain. You know, you carry aspirin on you. I'm a big believer in that. And if aspirin came out today, I guarantee you it would be prescription, because I'm sure some pharmaceutical company would see the need and make tons of money on it. So aspirin, I told you a year and a half ago, and I've been doing it in the clinic for years. If someone comes in and I'm going to ship them to the emergency room and I feel that they're having a heart attack, or I have a STEMI, which is a ST elevation myocardial infarction, you know, for years we've been giving 4 chewable aspirin. Or if you're in the outdoors hiking and you feel that you have a heart history and you're having chest pain, it's 4 chewable aspirin. Well, the American Heart Association a few years ago has changed that, and the reason why, there was a study done, 50,000 patients, and they found out that giving 2 versus 3 versus 4 81 milligram chewable aspirin did not have an outcome that was detrimental cardiac-wise, but the more aspirin you gave, you had an increased risk of having a GI bleed. So aspirin will give you a GI bleed, there's no question about that. And they found that that was a little bit of a higher risk. So a lot of the recommendations now, like in the United Kingdom, they're not doing 4, they're doing 3. In Canada, they're doing 2 chewable aspirin. So I'm going to throw one of the research articles up here, and you can see at least the headlines, and I'll write down below some of the other articles. So what do? Again, you're going to be fine if you take some aspirin if you feel that you're in a situation that you are very concerned you might be having a heart attack. Now, I'm asked frequently, well, what about if I'm having a stroke? And that's something, we're going to get into that down the road. I have not addressed that. So that gets a little funky, because there's 2 ways you can have a stroke. You can have a clot in an artery in your brain, and that would be great to take some aspirin, but how do you know that you didn't have an artery or a vein rupture? Let's say you have a bleed and you take an aspirin. Now what have you done? Now you've made the stroke worse. So what do? And we're going to target that down the road when we, talk directly about strokes in the outdoors and the signs and symptoms of, and you're on a trail and you have high blood pressure and God forbid you have the signs and symptoms of stroke, what do? And that gets kind of hairy. So what I'm advising is, number 1, if you're going to go on a 7-day trek, 3-day trek, and you have a history of heart disease, you need to be in shape. You need to check with your healthcare provider. Number 2, check with your healthcare provider. Say, hey, I watched this guy on YouTube, and he said that I should only take 2 aspirin or 3 aspirin. What do you think? Oh, and your provider's going to go, roll his eyes and go, oh my God, another Google doctor, someone that's looking at YouTube for medical advice. So ask your provider, all right? So what do I recommend? I've been doing 3 aspirin. I'm not doing 4 aspirin anymore at all. If it was me, if it was my wife, I'm doing 3 aspirin. So that's where I'm at. So I'm doing what the United Kingdom is doing. I'm doing a 3 aspirin, chewable, 81 milligram tablets, chewable. And that's the news. So when things change in the medical profession and it hits the outdoors, it could really, impact what we do with wilderness medicine. I'm going to let you guys know. I'm going to keep you updated and keep you up with the very latest research. All right, keep your eyes on the rise and your face to win. See you next time.